Okay, ankle evaluation. I'm going to start by asking any past or present history, and then inspecting, looking for any swelling, discoloration, or deformities of his ankle. And then we go into bony palpations, so at the shaft of the tibia and the fibula, and there, checking for fracture. And then you have the lateral and the medial malleoli, checking for fractures, as well as the dome or neck of the talus, right in here, looking for fracture. And then soft tissue at the deltoid ligaments. So you have the anterior ligament, the CF, I guess, or mid, and then the posterior ligaments, and you're checking those for any sprains. And then here on the lateral, we have the ATF, the CF, and the PTF back here. Also looking for sprains. And then the anterior tibiofibular ligament coming across, looking for sprain. And then the peroneal tendons for tendonitis and subluxation back here and going up. And then our special functional test, so the squeeze, the referred pain test, is looking for fracture, which she has none. And then the calcaneal bone test for fracture. Normally you would distract them because that would hurt if they had a fracture. And then stress tests of the ligaments, so plantar flexion and inversion is doing the ATF. And then going in to neutral is the CF. And then, wow, you're not flexible.
Thanks.
The PTF right here. And then we would do plantar flexion and eversion. Go this way. And then a neutral and eversion for the mid. And then up. And eversion for the posterior. Then the anterior drawer test. So stabilizing here and then pulling up. And then posterior drawer, we're going to stabilize. And then go down posteriorly. Let me get some crunching in there. And then range of motion testing, always done passively and actively. I'll be doing them passively with Daniel. You have ankle dorsiflexion at 20 degrees, and then ankle plantar flexion at 50 degrees. Then you have inversion and eversion, both at 5 degrees. And then resistive range of motion testing for muscular strength and ankle plantar flexion, so you're going to push down against my foot. And that's using the gastrocnemius and the soleus, both innervated by the tibial nerve. And then foot, so dorsiflexion, you're going to go up against my hand. That's using the tibialis anterior with the deep peroneal nerve. And then inversion, so pushing in against me. Using the tibialis posterior, also the tibial nerve. And then out, push out against me. Thank you. And that's the peroneus longus and peroneus brevis back in here. Innervated by the superficial peroneal nerves. And then neurological testing motor, so L4 is ankle dorsiflexion, so dorsiflex, thank you, and invert is L4, L5 toe extension, and S1 ankle eversion, and S1, S2 is ankle plantar flexion, so pushing down, thank you. And then sensory, you have L4 medially, side of the foot, L5 is dorsum coming up into the toes, and then S1 is the lateral side of the foot going up. Your reflexes, and have you flip over, please, and check your Achilles tendon reflex. Yeah, that's S1, and then you can come back over, flip back over, doing the blood flow test, so you check the dorsal fetal artery pulse. You're dead. And then the recapitalization test, pushing down and making sure that blood flow returns within 2 seconds. And you always bilaterally compare.